uncertainty out there about the whole government shutdown in terms of Social Security and Medicare. So I'm going to talk about that today. This is also a live Q&A because a lot of people have questions. Okay, it's a shutdown. I know I'm going to get my check. I've got a few people that already reached out to me in my comments and chat and other places and said, I didn't get my check on the 1st. I always get my check on the 1st or the 2nd or the 3rd. I didn't get my check yet. It has nothing to do with the shutdown. The shutdown doesn't affect outgoing checks, particularly ones that come on the 1st, because those have already been sent to the direct deposit. That is, it's already been done by Social Security, already told the Department of Treasury, and Department of Treasury went ahead and send out the checks, and they will continue to send out the checks. So that is not an issue. A lot of social media people out there talking about shutdown, how it's going to affect Social Security and all that. But as of right now, it's not going to affect Social Security in terms of if you're in what's called current pay, in pay. Social Security would call it LAF-C. That means you're in current pay. If you're in LAF-C, if you're in current pay, you got a check last month, you're going to get a check this month. If you don't, then there's something else wrong there, and that's what we're going to talk about today. If you have a pending claim, or you want to file a new claim, or you have some other type of issue, Social Security calls it a PE, a postal entitlement issue. Or if you have Medicare and you need to sign up for Medicare, any of those type of things, we're going to talk about that today. And so we'll teach you how to navigate the system and work into the system. Here we are, day 3. But I would argue we are in day 5,390 of, it's, you got to laugh. The alternative is to cry, I guess. We are in day 5,390 of the Social Security shutdown. And what are we talking about here? Well, the baby boomers, you see these gray bars up here. There's the baby boomers born between 1946 and 1964. 10,000 so people turn 65 every single day, and that number is going up and up and up. Back in 2010, Social Security employees, the people that help you get your benefits, make sure you're getting everything eligible, everything you're entitled to from Social Security, what you paid into it, they have met, the increase. And service was relatively good. It could always get better, always get better. But around 2010, politicians decided, for one reason or another, that hey, we don't want it to be easy to get your benefits. We want to make it as difficult as possible. We want people to hate Social Security and be completely frustrated. That way, eventually, we can come to them when this day happens. That is, the cuts eventually start happening, and we will say, hey, we tried nothing, and we're all out of ideas. So let's go ahead and just give it over to Wall Street. And that's been the plan for a long, long time. So we are in terms of no action by politicians to make sure those cuts don't happen, 40 years of inaction. So I did the math. When the Greenspan Commission was passed, that's when they raised the retirement age to 67 and did a bunch of other stuff. That was 15,507 days ago. There has been no real action by Congress, our representatives, to make sure Social Security is going to be here in terms of, it's going to be here. Social Security will be here if we don't privatize it. But the problem is, your checks are going to be cut. Everybody's check is going to be cut by 23% in 87 more checks. So 15,507 days of inaction by Congress. All right, so we're 3 days into the shutdown, but I would argue for all intents and purposes, it's, they've been slowly shutting it down for over 5,000 days. Okay, so reach out to your politicians and let's make sure this doesn't happen. Okay, so those people in pay, you're gonna get your pay. If you're one of the very, 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 very small percentage of people that were getting a actual paper check, those ended September 30th. Unless you made other type of arrangements, you set up a direct deposit, direct express, or there was an exception you can fill out with the Department of Treasury to get that paper check. I haven't heard anybody that did that. If anybody did that exceptions to continue to get their paper check, please let me know how that whole process went. Okay, so if you have a pending claim, that is, you filed for retirement benefits, disability benefits, survivor benefits, and it's just sitting in the office. I get that all the time. And it's just sitting there and sitting there and sitting there. One of the problems with this long shutdown is because it got far, far, far worse when Elon Musk and Doge went in there and with their chainsaw and started just cutting jobs haphazardly with no rhyme or reason. And that's another reasons why they don't pick up the phones. It's been like that for a while, but it's gotten 10 times worse recently. And now you get AI, artificial intelligence. So if you've got a pending claim and you're wondering what's going on, it really depends on what type of pending claim you've got. If you've got a retirement survivor benefits, those spouse benefits, if you filed for Medicare Part A, Part B, special enrollment period, I'll talk about some tricks there. Then based on me doing this a few million times and running the third business Social Security office in the country, all of those, if you've provided all your documents and everything is good, and there's an employee there to actually push the button and adjudicate the claim, it takes a few days. To a retirement claim, I've done hundreds of thousands of retirement claims in the old days when you used to go into the local Social Security office and sit down in front of me and I would ask you a bunch of questions and take about, 20, 30, 40 minutes or whatever. And then I'd walk you to the door. And then by the time you got out of the building or got to your car, your claim was done. It was adjudicated, finished, end of story. I went on to the other 400 people. That's how it normally would happen. Now, you can't get an appointment for a month or two, and everything is taking a lot longer. So if your retirement claim, survivor claim, if you provided all the necessary documentation, you should theoretically, in the best possible world, you should have everything done in about a week or so. And if your benefits are due tomorrow, then you should get them tomorrow. That shouldn't be an issue. If you're talking about disability benefits, got a lot of questions already here, so I'll get into some questions here in a little bit. But if you're looking for disability benefits, then you know that unfortunately it's taking way, way, way too long, longer than it should, 6 to 9 months to get a disability claim decided on average. If you've got a really bad disability, then just might get it approved the same day or the next day or within a week or so. It's called the TERI cases, terminal illness type of cases. Those are adjudicated almost immediately. I've had many that are approved the same day. But if it's just you're not able to work because of a disability and it's not a terminal illness, then unfortunately it's taken anywhere from 6 to 9 months. But during a shutdown, there are things that Social Security is not allowed to do. You can't get a benefit verification. It's hard to get into replacement Medicare card. You get a replacement Social Security card you can't do. But on the Social Security card, so those people out there just need a replacement Social Security, not a new Social Security number or anything like that, just a replacement. You can do that online in most states. The computer system, they finally connected to the DMVs of the different states. And when you file online, the Social Security, as long as you're not making any changes, you're not changing your date of birth or your name or anything like that, you just need a replacement of the same exact one because you washed it or lost it or whatever. Then you do it online. The Social Security system talks to the DMV in your particular state, confirms everything is good, and if everything passes perfect, then they kick you out a Social Security card and you should get it in about 10 days to 2 weeks. Shouldn't be an issue there whatsoever. If you are, let's get a quick question. Let's jump in. We'll jump back and forth questions. Donna in Michigan, her plan was canceled, called another plan. Agent said underwriting needing unless I got a plan F or G, etc. Health test required. Yes, if your plan was canceled, and there's about 1 million people, estimate about 1 million people that are going to get their plans, their Medicare Advantage plans canceled, particularly the PPO plans, because health insurance companies are trying to make as much money as they can on each person, and those PPOs are a little bit more expensive for them. So you probably have a PPO, and yeah, they're canceling you, and you have guaranteed issue rights. We had Ari from Chapter here yesterday talking about that and what that involves. That it just questions if you have to go through health underwriting to get a Medicare supplement plan. That's the only one you have to do health underwriting for, is a Medicare supplement plan, like a plan G, F, N, or whatever. Then you have to answer about 20 or 30 questions. And if you answer no to most of them, then you're good. If your plan was canceled, then you have a guaranteed issue. But yes, you can only have it's only for an F. That is if you were eligible for Medicare before January 1st, 2020. Other than that, a G. You can't get an N. That's not a guaranteed issue Medicare supplement plan. You'll have to go through health underwriting and get an N. Depending on your state, each state is a little bit different, but you can reach out to a chapter there and they can give you a little bit of a heads up on what's going on there. Okay, so let's get back to our story here, but I'll jump in and answer some questions along the way as well. So if you've got any questions, make sure if you're watching this in a recording later, make sure you subscribe and like and all that kind of stuff in case you or your friends or family, neighbors ever have any problems with Social Security and they need answers. All right, so if you're filing a new claim, you want to file for a new claim for retirement, disability benefits, survivor benefits, spouse benefits, whatever the case may be, call immediately. The most important thing is called protective filing. So don't wait. If you want to file for benefits and you want those benefits to start in the next few months or so, call Social Security, and because once you call, that protects you for that month. So let's say you call, in this month in October, and you want your benefits to start this month in October, but you don't get your appointment until November, December because, your local office doesn't have any staff. Not an issue. If you don't get your actual appointment until December, at your appointment in December, you just tell them, yeah, I called you all in October. So my protective filing is in October. I want my benefits to start in October. And no problem whatsoever. Just tell them protective filing. And even though you don't get your claim adjudicated until December, you can get that 2 months of back pay. So make sure you don't miss that back pay. Okay, so but you need some lead time to do that. Make sure you can file online. But even people think, well, I filed online, it was no problem. Don't need staff when you file online. No, every single one of those applications you file online, there's a person on the other side that looks at that to make sure your earnings record is correct, to make sure your status is correct in sort of your U.S. citizenship or green card, make sure everything is correct. You're check any spouses that you have, and if there's any leads, as they call them, Social Security, if you have an ex-spouse that might be entitled to benefits, they have to reach out to that person. So there's a lot of things that has to be done behind the scenes, even when you file online. Okay, so the important thing is to get that done. And one of the big things we're seeing now, particularly with this annual enrollment period that's going on right now, people are signing up for Medicare. A lot of people are losing their jobs. And if you're signing up for Medicare fresh, that's fine. Again, if you've got time, you've got a month or two to wait, then that's not an issue. But what we're seeing is a lot of people losing their employment right now, and they lose in their health insurance. And so they're, 66, 67, 68 years old, and they go ahead and they need to sign up for Medicare, but they need it to start immediately. They can't wait for a month or 2 months or 3 months to get it, adjudicated to start. They need it to start, I need, to start next week. So in that particular case, during a shutdown, you really have to be forceful. I mean, not violently forceful, but you have to. Don't do it online. If you need your Medicare to start within the next 2 or 3 or 4 weeks, don't do it online because they might not be able to get to it. I wouldn't schedule an appointment. You might want to try and say, hey, it's an emergency. Can I get anything, like tomorrow or next day or something like that? But if you can't get something immediately and you're going to be without prescriptions or, health insurance for a month or so, then you just have to go down to the local Social Security office. And local Social Security offices, I talked about this a few days ago, but Federal Protective Services, the guards at the front are Federal Protective Services. They're not Social Security employees. They're contracted guards, private guards. And so you just have to tell them they listen for a few key words. They don't let people in sometimes a little bit, depends on your particular guards. They're a little bit more gung-ho than other guards, but they listen for particular words. So if you say things like, this is a PR issue, this is a, this is a health issue. I need my prescriptions. I've called my congressperson and this is a congressional issue, type of things like that. And they say, oh, okay, all right, we'll go ahead and let you in and have your forms ready. So if you're looking for a special enrollment period, then you're going to need a couple of forms. And you can go onto my website and get them there, or you can go onto ssa.gov. You are going to need two forms, the 40B and the 564. And I've got links to those right there. Super, super easy to fill out. So you have to take those down and get your special enrollment period. But make sure during the government shutdown, everything is going to take longer than usual. And we want to make sure you don't go without your prescriptions or your doctor's visits or whatever the case may be when you need to. All right, so there's tons of exceptions. This is also, we're beginning the annual enrollment period. So if you're looking to change your Medicare Advantage plan, or you were one of those people like Donna who got their plans canceled, and now you have the option to check out a Medicare supplement plan, you don't have to go through underwriting. Guaranteed issue. Just make sure you keep that letter. That letter is your golden ticket. So you just need to be prepared. So it doesn't matter who helps you look for a new plan. You just need to be prepared. Have your current plan so you can compare it. Have your providers, you know, the doctors you definitely want to keep, what prescriptions you have to have, what pharmacy, if you have a particular pharmacy you have to have, what your priorities are. You need to save money here. You need to save money on a hospital. You want some extra dental, vision, or whatever the case may be, and tad bit of patience. Don't expect on calling anybody on October 15th to getting through. It's going to be a crazy season. So if you need help, reach out to Chapter. And remember, you haven't October 15th to December 7th. I would probably wait. I wouldn't wait till the end, till December. I would probably like this. The end of October, November is the best time to call. But your plan won't be effective until January 1st. So, you know, you shouldn't have an issue. If you have an issue getting through Chapter specifically, make sure you reach out to me during the live Q&A, and we will reach out to Chapter and make sure you're taken care of. All right, let's get into some specific questions. Catherine, because my husband started getting his Social Security, now according to DES, we make too much money, and my EBT was cut by $225 a month to $25. Yeah, because we make $100 too much money. Yes. Yes, the food stamps, Medicaid, all of those are income resource based. Well, predominantly income based. So if you make more money, then yes, they offset that. And it's kind of crazy. A few years ago, when they had the big COLA, the 8.7%, because inflation was so high, they had a high COLA. And people say, well, I wish I had I wish the COLA was, 6, 7, 8, 9, 10% this year. Well, that means we had terrible inflation. So it's bittersweet, I guess. But a few years ago, when they had the big COLA, the 8.7, people got more in their Social Security, and they were very, very happy. But the people that were low income, it's like, okay, I got an extra $80 in my check, but now I'm $2 over, and I've lost $400 worth of food stamps, or $290 worth of food stamps. So they're like, okay, well, I got $100 here, but they took $200 there. So it's there was an act, or there's a bill in Congress, and we know what that is, right? There was a bill in Congress that we're talking about, okay, instead of 100% in terms of, okay, if you go $1 over, we're going to cut everything off. So you go $1 over, we're going to cut you back for $200 for food stamps. There was a bill in Congress that makes no sense whatsoever. If you're $1 over, then maybe we'll offset it by $5 or something like that. But unfortunately, the bill didn't go anywhere. The song didn't start and it didn't end, unfortunately. Dr. Ed, question, considering moving abroad, would you suggest having multiple bank accounts, including one at my destination, however, keep my U.S. account as a precaution? You're the GOAT, Social Security and Marine Corps needs. Right. Multiple bank accounts, sure. But in terms of Social Security, you can only do one bank account. If you're going to use an overseas bank account, which you can, you have to know the SWIFT code and everything. If you're going to switch your Social Security check to an overseas bank account, be very, very, very careful. Social Security employees don't do that very often, and they often mess it up. So if you're going to do that, keep your old American bank or whatever bank account you're using, keep that open. Then if you want to switch to an overseas bank account, you can do that. But in case something happens, you should have a fallback. So don't close the other one until you know 100% for sure it's going into the new account. So just be careful there. Let's see. Catherine, what is the cutoff amount for EBT? Yeah, each state is a little bit different. And because of those cuts, for food stamps and Medicaid and the Affordable Care Act and all of those cuts as part of the Big for Billionaires bill, then yeah, it's going to be very, very tough. And we're coming up with a system to help you all with those food stamps and stuff. But each state is a little bit different. But all the states are going to get even more difficult. So there's going to be a lot of people out there, vulnerable people, that are going to be having a hard time, paying for food. And a lot of people are also losing their grocery card that they got from their Medicare Advantage plans. There was it's called VBID, and that program ends December 31st. And that's the one that, you heard about all the grocery cards, those Facebook commercials. So you get $200 to $300 a month for grocery cards. They did exist, but they're not going to exist anymore as after December 31st. There's another program, a smaller program, a more limited program that's going to continue that has those grocery cards. But people have been reaching out to us already and said, yeah, I checked my plan for 2026, number one, awesome, and I'm doing that. And they said, yeah, my grocery card went from $200 to $50, and now I have to jump through a bunch of hoops. And yeah, that's... and if you need help, again, reach out to Chapter there, and they can see if they can find any of those for you. Emergency supply, mac and cheese and ramen and canned tuna fish and some good multivitamins. Yeah, it's... Ed, I have always heard you can't laminate your Social Security card. Why is that? Yeah, they suggest you don't laminate it because if you laminate it, it's hard to detect whether it's authentic. So, you can change the numbers underneath there and then laminate it, and it's harder to tell whether the numbers were changed under there. So, yeah. And then there's a company out there trying to scam people that says, hey, Social Security is turning into these metal cards, and if you send us, $49.99, except in Nebraska or whatever. Ronco, I think what Ronco's doing is the pocket fisherman. Is that still a thing? But that's a scam. And there's companies out there that want to charge you to get a replacement Social Security card. That is a scam as well. I think they don't charge you to apply for a Social Security card because that's illegal. They charge you for the SS5, which is the form that you need to fill out to get, which is free online. So don't pay to get a Social Security card. Don't pay to get a replacement. Yeah. There was a famous, I need to pull that up one day. There was a famous, in the Depression, there was a guy, good looking guy, and his good looking wife had their Social Security number. He had it tattooed on him. So I wouldn't recommend that either. So I'll find that picture and show it sometime. Ed, I actually filed a Form 561, protective filing status. I filed that on September 10th and haven't heard back. What are the expectations and what should I be concerned about? It really depends on what the 561. The 561 is kind of a catch-all request for reconsideration. So anytime you disagree with a Social Security decision, that's the first document you go to as a SSA 561. I want you to reconsider your decision on whatever case. So it goes to another employee in that office, not the one that made the original decision, but another employee. So it really depends what it is. If it's if you were denied disability, then it's going to take, 6 to 9 months. If you are, disputing an overpayment or something like that, it's going to take weeks. So it really depends what the issue is and whether your local Social Security office has employees. And remember, Social Security offices are broken up into 3 different units. You have the regular generalists, you have people that specialize in SSI, the welfare-based program, and then you got, like I was, that did the retirement, Medicare, survivor benefits, Social Security disability insurance. So if you are requesting a reconsideration on one of those and there's nobody in the office, because a lot of people, my good friend at Social Security, his last day was yesterday. He officially retired. He was going to work about another, probably not, he said 5 years, but he would have probably worked another 10 years. But he decided he's had enough. The agency is just, yeah, so he decided to bail. So retired Air Force guy and everything. So it's sad. He was a phenomenal guy. Good thing for this channel, I applied for my RIB, retirement insurance benefits, for those new people here. We've got an awesome community that knows the acronyms, and that always scares the employees when you go into the Social Security office and they know they can't pull the wool over your head because you know all the acronyms, and they're like, oh, okay, well, we've got to make sure we treat this person right because they know what they're talking about. And Linda and the rest of the team help other people in their community. So we've got the best community online. All right, I applied for retirement insurance benefits in August and have been patiently waiting to be processed. I heard Ed say the other day that if someone's waiting 6 weeks, something is wrong. Yeah, if you got all your documentation in there, you know, if everything was good, you didn't have any scrambled earnings, as we used to say. Scrambled earnings, that means your earnings record is clean. Scrambled earnings means it's like a scrambled eggs, where you've got, you know, your earnings record, you know, someone who was working on your earnings and you're missing that and you're missing this and you have a gap year here, whatever the case may be. If everything was good, then as I said, you know, if you would have, you know, had the opportunity to go into the local office and do it right face to face, by the time you reached your car, your claim would be done. That's if everything, you got your birth certificate, if you needed a birth certificate, you needed a passport or whatever the case may be, yeah, it would have been done. Now the only question is when your benefits are going to start. So if your benefits are not going to start until like November, December, then you might be done. But what happens is the computer system that waits for the COM month, as it's called, the current operating month. And if your benefits are not due till November, the computer, your claim is already done. It just sits there until it kind of goes into the cycle of printing out your check and getting everything ready. And then when that happens, then they will send a letter that says, hey, everything is good and everything, we did your application, you're going to get this much on this particular time. So, but if you are supposed to get money, if your month of entitlement is September, then yeah, something's definitely wrong. If your month entitlement is October, something is definitely wrong. You should have already received that letter. You're not going to receive your October check until, depends on your birthday, second Wednesday, third Wednesday, fourth Wednesday. But you should have already received that letter. So yeah. Let's see here. I heard from someone who on their YouTube channel said that people are getting a new around something like a stimulus check or a Doge check. Yeah, 100% incorrect. Yep. As I always say, the way you tell whether we are getting a stimulus check is you have to see these right here. If you see the President of the United States in front of the flag and, front of the flag behind the podium, patting themselves on the back of how awesome they are, they're giving you, $800 back of your money. If you don't see that, you're not getting a stimulus check, because when presidents give money like that, they're going to, sound their horn and go up there and say about how awesome they are. Yeah, there is no stimulus check on the way. It's just a bunch of social media people trying to get clicks. It's unfortunate. Why am I not eligible for a grocery card if I am on Social Security supplement instead of the Advantage program? Because the grocery card is only part of a Medicare Advantage plans. They're the only ones. And going forward, and particularly starting this year, but going forward next year, they're only really part of the special needs plan, particularly like the dual special needs plan. So if you have Medicare and Medicaid, and you have a Medicare Advantage special needs plan, then those are the ones that you might be able to get a grocery card. Even more so previously, but starting December 31st, not so much. So yeah, with a supplement, you don't get any of those extra benefits. But, well, the extra benefit you get is you don't have a network, you don't have an insurance company, second guessing your doctor. So you get the best benefits, I guess, right? The channel, not the clickbait commenter, also said tariffs were a good thing. I much prefer facts to marketing. Thank you. Yeah, tariffs are, it's a tax on us. It's a sales tax. How long it takes to get down to us, that's a whole different issue. But eventually, these billion-dollar companies, I don't. There's some people who think out there those billion-dollar companies are really awesome and they're altruistic and they're looking out for their customers versus their board of directors and their shareholders. There's companies out there like that, but most of them, it's like, hey, we got extra costs that we have to eat. We're going to pass it on to the consumer, and so it's basically a sales tax. All of that does affect Social Security, because when you get tariffs, that increases inflation. And inflation, theoretically, that affects COLA. That's all different now that the Bureau of Labor Statistics person is a political, anyway. But if you get higher tariffs, that means higher inflation, and that means a higher COLA. And people say, oh, awesome, more COLA. But that just compensates for higher inflation. So you don't really, win anything, actually. You don't lose. You're supposed to not to lose or win. You're supposed to just keep level. But the problem with that is a higher COLA. That means more coming out of the Social Security Trust Fund, and that means less of those. So tariffs equal higher inflation, equal more COLA, equal more money coming out of the Social Security Trust Fund, and therefore probably next year when they come out with the new numbers, then they might mark it down, by 5, 10, 15 months or something like that. So unfortunately, it affects your Social Security check and when that's going to be cut. So, one, under current turmoil, should I apply to start getting benefits now or wait until January as I originally planned? It's really your decision. There's a lot of people that make a wrong decision at the end of the year because they just don't understand how the work requirements go. So this is the busiest time of the year, October, November, December, January for Social Security, because you got a lot of people wanting to start their Social Security retirement benefits in January. And they think, well, I need to start in January because this year I made over $23,400 and I'm not my full retirement age yet. Okay, that's correct. If you're under your full retirement age and you earn over $23,400, then yes, Social Security will hold back $1 for every $2 you go over. However, there's also the monthly earnings limit. And the monthly earnings limit for this year is $1,950. So if you are going to earn under $1,950 this month, November and December, you can start your benefits starting October. And it doesn't matter. If you made $1 billion, I'm sure you wish that was reality, but if you made $1 billion up until September, Social Security doesn't care. They only care about once you start your benefits. So they'll say, okay, you want to start your benefits in October. Are you going to stay under $1,950? Yes, because you already went over the $23,400. If you didn't go over, then it's not an issue. But are you going to stay under $1,950, start October, November, December? Yes. Okay, we can start your benefits in October. So the political turmoil and all that, some people are making that decision, and it's a one-on-one. Nobody can tell you when you should start your benefits unless they ask you a bunch of questions. Life expectancy, your how healthy you are. Do you need the money? Are you going to continue to work? And there's a bunch of questions you have to ask yourself. But yeah, now the political thing is, the political thing definitely needs to be factored in there as well. Steve and Indy, I called Chapter the other day trying to sign up for Part B. I told her I'd be keeping my work insurance so that my wife would have insurance, and she told me I shouldn't sign up for Medicare. Yeah, sounds like they did the right thing. Awesome. So yeah, if you're, so the other day to sign up, so you told her, okay, so you're signing up for your, or both of you, okay. If you or her, doesn't matter. If you have health insurance from work, current work, and the employer has 20 or more employees, then you do not have to sign up for Part B. Don't waste $185. And Chapter doesn't sign you up for Part B. You have to go through Social Security, but at least they told you that you didn't need to waste your time or money. So if you're happy with your insurance from current work, her work, or your work, or whatever the case may be, then you don't need to sign up for Part B. You know, if you're currently receiving benefits, they'll sign you up for Part A automatically. You can sign up for Part A if you want. It's zero premium, but B, definitely don't sign up because you have health insurance from work and it sounds like you're happy with it. So keep on keeping on. Next year, 2 years from now, 3 years from now, when her or you stop working, then you have to sign up for Part B. And then call chapter back and say, okay, I signed up for Part B. I have Part A and I have Part B now. So tell me, how do I fill the gaps? You know, tell me about a Medicare supplement, Plan G or Plan N. Tell me about Medicare Advantage. Tell me about prescription drugs and all that kind of stuff. But if I probably wouldn't waste your time on any of that, because if you're not going to lose health insurance from work for another year or 2 years, there's no telling what's going to happen in the next 1 or 2 or 3 years. So I wouldn't spend all your time studying what you need 2 or 3 years from now, because yeah, it might change. So just keep on keeping on. And you don't need to notify Social Security that you don't want A or B. If neither of you are receiving Social Security benefits, they don't care. If you're receiving Social Security, then they'll sign you up for Part A and Part B automatically, but it doesn't sound like you are. So yep, they told you the right thing. Awesome, good to hear. Let's see. So people that didn't get paid on the 1st or 3rd was due to no paper checks, not direct deposit. Yeah. Or it just, something else, something was messed up, a general, just a regular snafu in the system. The person have an overpayment, then they were overpaid, or the direct deposit went into the wrong direct deposit bank account or whatever. So but whatever the issue is, it's not shutdown related. To get it fixed. Oh, and I forgot to mention that. So if you need a check, if you didn't get your check when you were supposed to because of whatever snafu there, then you need to go down to the local Social Security office. And if you have an emergency, like an eviction notice, or they're going to shut off your electricity or heat or something like that, then you take that down to Social Security. And if it's a dire need situation, they can actually cut you a check right out of the office. So you say, hey, you were supposed to pay me yesterday, day before yesterday. And they'll say, yeah, we'll go ahead and, yeah, we see what happened. It got messed up somehow, and we'll go ahead and redeposit it. And that'll take 2 or 3 days. And if you say, oh, okay, yeah, 2 or 3 days, I'm good with that. But if you say, no, I need to go pay my rent today, then you show them that, I need to pay my electricity today. You show them that, and they will cut you a paper check, and then they'll provide you a letter with it. Because when you take that paper check down to the bank to cash it, it's a weird looking check. It's not your typical, U.S. government check with the Statue of Liberty. And so the banks always call up. They used to call me up and they said, hey, we just had Deborah down here with a weird looking check. Is that from y'all? And say, oh, yeah, Deborah. Yeah, we sent her down there. So, yep, it's a government check. Go ahead and cash it. And they go ahead and cash it. So if you're in dire need and you can't wait for a redeposit, then you can get a check. So good on you for doing all this for folks. Thank you. I appreciate it. And most importantly, good on all the folks doing this for other folks. That's the key right there. I'm just one guy giving out all this information, and I'm just asking you all to share it as much as possible. So, and if you don't know anybody, press like and subscribe and share and all that kind of good stuff. That by doing that, you get it to more people. So appreciate it. Could you do a comparison between regular A and B with Advantage and A and B with Supplement on a $200,000 hospital bill? Oh gosh, that's with a $200,000 hospital bill for let's see here. I mean, I could do let's see, where's my for a Medicare supplement plan. So if you have a $200,000 bill and you have a Medicare Advantage, it depends on what your Medicare Advantage plan says. If it has $500 a night for a hospital, then you have to pay $500 a night. And then there's a maximum you can pay, the MOOP, the maximum out of pocket. So it really depends on your Medicare Advantage plan. But if you have let's say if you have a Plan G, you have Medicare Part A and a Plan G, your max out of pocket is $257 and you're done. So if your hospital bill is $200,000 or $2 million or $20 billion, you have to pay $257 if you have a Medicare Part A, Part B, and Plan G. So let's see. Since I'm in month 7 of my IEP, turned 65 in July. I'm enrolled in Part A, not B. I mailed the CMS 40B 2 weeks ago, but no Part B is shown online. Should I go into local Social Security office? Yes. Since you're in your 7th month there. So basically, let me pull up the chart here. Okay, so your initial enrollment period. So 3 months before you turn 65, the month you turn 65, and 3 months after. So it looks like the 3 months after was July there, or well, you're 65, so 3 months after that. So normally you send it in a while ago, but sending it in, that means it's on somebody's stack somewhere, and that particular office might not have the staff, and so it's just just to make sure everything goes through okay, I would reach out to them, either give them a call at their local number, or call the 800 number and see if you can get through the AI garbage, and they'll be able to look online. Or you can call Chapter, or any other Medicare insurance agent is supposed to have access. Chapter definitely does. So maybe your Part B card, it comes together Part A and Part B. Maybe your new Medicare card was already mailed out yesterday or 3 days ago. And so you can call Chapter or whoever signed you up for Medicare Advantage, and they should be able to look into the system, or whoever you're gonna work with. They should be able to tell whether your card is in the mail. They will need your Social Security number in that particular case. So make sure, you trust whoever. So let's see. Yeah, don't forget to hit the like button. I appreciate it. The leader of our country said he was thinking of sending out $2,000 checks. Yeah, that won't happen. Yeah. I think I will have more hair next week. Social Security and Medicare, so much to learn. Old folks can't retain all this mumble, even with the college degree from 60 years ago. Yeah, it's way, 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 way more complicated than, all of it. And you know what the crazy thing is? I talk to people, and they ask, oh, wow, I saw you got a YouTube channel, and I'm from England, or I'm from Japan, or I'm from Germany, or whatever, Canada. And I talked to them about it. And in those countries, I couldn't do what I'm doing here. Because in those countries, if you have a problem with their Social Security or Medicare, which it's super, super easy to resolve, you call the local offices and stuff, and they pick up the phone and they answer your questions. So in those countries, there's nobody like me in other countries that I know of. If you're from some other country and you say, oh yeah, there's other people in other countries, kind of like you, Ed, that help you navigate the bureaucracy, I haven't heard anything. We are the unicorn here, which is embarrassing. So my insurance company finally told me that my Advantage plan is going away, not by mail, but email, and wants to do a virtual consultation of what they have now. So yeah, you can definitely do that. But remember, your only recommendations are going to be their other plans. Because a lot of people don't realize that, each health insurance company, you're like, oh, I have that company. Okay, you have that company, and version 4 or 5 or 6 or 7, or last year's version, or 3 years, whatever. They have multiple plans. So your company has multiple plans as well. And a lot of companies like for you to stay on your current plan and they don't want you to check, because, they change all the terms, and they don't want you to check of how much you're going to be paying out next year. So they would rather you just kind of don't do anything. That's one of the reasons it's so complicated. They make it complicated for a reason, I would argue, allegedly. But yeah, I would reach out to whoever you trust. You reach out to Chapter, whoever, a broker that has access to all the plans in that company and all the plans in other companies in your area. And that way they can compare everything in your area. And remember, anytime you call anybody on all that, make sure you're prepared with the 6 Ps. because we don't want stuff, and we don't want a bunch of people reaching out in January, February and says, oh yeah, I talked to my brother, I talked to Chapter, whoever, and I switched plans, but I forgot to add this provider. I forgot to add my pharmacy I forgot. So, be prepared. Have your current plan, the providers and your priorities and all that kind of stuff. And that way, when you talk to whoever you talk to, you've got it all down there and you won't forget anything. And then, you've got the best plan for you for 2026. So that's the key. Rose, Dr. Weir could not remember how to get to your site. Felt so much better to advise. Oh, okay. Yeah, it's mygovexpert.com. So, and it's a free website. The only thing that we charge for is we've got Mai Jackson, which is she's a former Social Security employee. She worked for decades inside Social Security and she knows her stuff, and she does one-on-ones, but she charges for that, and that helps pay for the website and everything like that. But everything else, the website is completely free. So definitely take advantage of it. And we're coming up with a new one to help with Medicaid and food stamps and legal help and all the rest of it. So we old folks really need a pass. We have earned it to be seniors, don't you think? 100%. I agree. It's got to be made easier. And it's getting more difficult. There was, for instance, the big beautiful bill delayed a provision that would take effect 2026 to make it easier for people to get Medicaid and keep their Medicaid. But the big beautiful bill says, no, we don't want to make it easier. We want to kick as many people off. Even if they're eligible, we're going to make it so difficult to jump through all these hoops that people will get cut off. And that happens, unfortunately, all the time. Elderly people, vulnerable people, something happens in their local Social Security, social services, Medicaid office, and they said, hey, you forgot to fill out this form. And so whatever we denied you, you forgot to check this box, you forgot to date it like this, you signed it in the wrong place. So we're just going to deny you. And people read that letter and all they see is they denied me. And they figure, well, it's the government. I guess they know what they're talking about. And so I guess I don't get it. And they don't, that's how the system in a lot of respects is designed. And it's going to get even worse when states don't get all the money and they're going to go out there and actively try to kick as many people off as possible. I see that coming. We've seen it historically before. So after COVID, when they started to redoing the recertifications for Medicaid, there's estimates that about 60% of the people that were denied were actually eligible, but they were denied incorrectly. And hopefully all 60% fought it, but and I know, we all know that a lot of people okay, I guess I don't get it. I guess I'm going to have to eat cat food cat food is expensive, but anyway. So we're going to help those people. I eat potatoes and rice, and a good steak is not affordable. Pretty sad, although I'm very healthy. Yeah. I heard beef prices gone up considerably. 185 is steep if you can't afford it. I just checked Cobra costs for one. Nationwide average is $500 to $700. 185 sounds pretty good. Everything else is relative. Some people can't afford $100. Yes, and remember, I like that. You said, hey, for those people that can't get Medicare, they get the Affordable Care Act, and those prices are going up considerably. Well, technically, the premium prices for the plans aren't necessarily going up, high because, they're going up as regularly as they increase year over year. But the reason people are going to be paying a lot more for their Affordable Care Act is because those subsidies, the government subsidies, are going away. And why do we have government subsidies in the first place? To help people get health insurance, is because they killed the mandate. So if you have a mandate, like car insurance, if you drive a car, you have to have health insurance or car insurance. There was a mandate that said, if you have a body, you need health insurance. So, and if everybody gets it, it's cheaper for everybody. But when they got rid of the mandate, then people that are sick and elderly, they get the health insurance, and young people don't get it. And it costs more for everybody. And the prices just went up crazy. And the government said, we can't have people uninsured. So that's when they come in the subsidies. So it's like, yeah, the subsidies are terrible. They shouldn't be subsidized because prices should be lower. Yeah, so it's painting ourselves into a corner. If you design the worst possible system, oh yeah, we already did. So, and it's getting worse. And that the government shutdown is all about affordable health insurance. That's all it's about. It's not about illegal immigrants. Undocumented immigrants cannot get Medicaid. They cannot get Medicare. They cannot get the Affordable Care Act. Period. End of story. So, J.D. Vance, former Marine. Yeah, Semper Fi, huh? That is why so many seniors are doing van life to cut mortgages and insurance. Yeah, I saw a little episode on that. I was going to show it in the future. That's, yeah. And if they need an organ transplant, they are first in line and flown here and everything free. Okay, all right, whatever. What if they return SSI back to the states? Yeah, it's, Medicaid is kind of back to the states. Yeah, that'd be a big complicated thing. But what you talk about is SSI, supplemental security income. It used to be individual states would do. Sometimes they did, sometimes they didn't. It's a welfare-based program, and Social Security took it over, was given it by Congress back in 1974. So now Medicaid is done by the states. Food stamps are done by the states, even though, it's kind of a federalist system. So that means, in some states you would have it, some states you don't. So like in Texas, yeah, good luck in Texas or Alabama. It seems crazy that countries the USA is giving money to have universal health care, but we don't, and they're cutting insurance to folks. Yeah, I think we gave, 20 or 30 billion to Argentina to support some guy that, particularly one hedge fund guy that lost his money. So he called his other hedge fund buddy, the Secretary of Treasury, and we decided to loan a few $1 billion to Argentina to shore up that guy. So we got money when the rich people need it, right? Many have not gotten direct deposit today at Charles Schwab Bank, usually at midnight. Do you know what's up? No, I have no idea. It's Friday-ish? So maybe the weekend type thing. But I haven't seen anything like that. When that happens, usually every now and then in our jurisdiction, we had a Maine post office that their main giant mail sorting machine was broken and everybody's check was going to be delayed in that particular zip code and stuff. So they notified us and they said, in these zip codes, you're going to get a lot of people calling. So stuff like that happens. And so, we have word, but we have, I haven't seen anything like that. So my husband is 70 and 6 months now, either the shutdown, what we can't sign up for this month. If your husband is 70 and 6 months and he's not receiving Social Security benefits, he needs to get on the phone immediately, because remember, Social Security benefits continue to increase up until the month you turn 70 years old. And after that, it doesn't increase based on, waiting. You'll get your COLA and all that kind of stuff, but your Social Security checks after your full retirement age, after 66 or 67 or whatever, it increases 8% per year until the month you turn 70. So they can give him 6 months back pay. So, but if he waits till next month, he's going to lose a month of benefits. So call now, and that means you're protected for now. So if the appointment isn't until next month or due months or 3 months from now, no problem. They will give him 6 months back pay starting when you actually reached out to them. So call immediately, if not sooner. Run to the phone and deal with the AI. Good deal, Rose. I wish I'd help, but I'm about $15 close to being that same boat. Oh, people looking out for each other. You guys are awesome or what? Let's see. To clarify, get SSDI, and since I'm over 65, I can file for SSI and get 2 checks. Yeah, if your SSDI is under $967. So if it's under $967 and you have no other resources, if you're single, $2,000 in resources, married, $3,000 in resources, they don't count your house or your primary car. So yeah, if you're from SSDI or retirement or survivor benefits, if your check from Social Security is under $967 and you don't really have any other income or resources, then absolutely apply for SSI. People are eligible for SSI if they're disabled, that is under the age of 65 if they're disabled, or if you're over 65, then just the fact that you're over 65. It's called SSI Aged. But if your SSDI is over $967, then unfortunately, no. So America is a crisis here. It's time to take care of USA needs. We are in the crisis now, shutdown of government prayers for the president to consider funding America's health care. Yeah, that's what it's 100% about, health care for the American people. And the distractions about, the boogeyman, undocumented, that's been the playbook since the current president came down the escalator. It's all about blaming, undocumented immigrants. And so and again, they can't get Social Security benefits. They pay into the system. So people say, yeah, they do get it when they go to the emergency room. Yeah. I mean, before EMTALA, which was signed by Reagan, they had what's called patient dumping. So it was called, what do they call it? The wallet biopsy. So I guess JD Vance and them want to do a wallet biopsy again. What is a wallet biopsy? Is when you go to an emergency room, they check your wallet and see if you can pay. So if you've got a broken leg, you got a heart attack, you've been shot, or whatever the case may be, they don't check your body first, they check your wallet to see if you can pay. And if you don't have an insurance card or a bunch of money in there, then they send you to another hospital and, dump you, patient dumping. And that happened a lot before the 1980s. They would send you to another hospital because you couldn't pay. So do they want to return to that? And I guess the extra wallet biopsy is to confirm whether you are in this country legally. Or do you look like an American? Whatever the heck that means. If you don't look like an American, then, this person might not be an American, so they might not have health insurance, because it's all about, health and, these companies that are having to pay these uncompensated care. So, and doctors take, was it the Hippocratic Oath that says, if someone is in front of me with a heart attack, I'm a doctor, that's my job. It's not insurance or anything like that. So they help those people. But I guess they want to reintroduce the wallet biopsy and check to see if people have insurance. I guess even if they're here illegally, if they have insurance, then I guess they're okay. So I don't know. I don't like that system. I don't think we should return to that system that was around in the 1970s. The 1970s was awesome, great albums, but later 70s kind of got crazy. But anyway. DES said they denied my Part A and Part B now. Does that, DES? Yeah, not sure. Does that mean I don't have coverage and have to get it now? Or since Social Security would be taking out Medicare again? I'm confused too. Yeah, DES has nothing to do with Part A and Part B. Maybe what you're talking about is paying, you're not eligible for, you didn't pay into Social Security and Medicare or Medicare enough, and you're not eligible for the zero premium, the free, Part A, Part B, or free A, and you don't have the money for Part A, Part B. So the state was paying for those for you, but you're still eligible for Part A, Part B. You have to pay for it. Reach out to Chapter and or whoever, and see if they can untangle that one for you. They also help you with, kind of navigating and kind of give you an idea where you're at and where you need to go. Let's see here. Can you change from a plan to Medicare, and then if you don't like it, can you change back? It depends what that particular company has. Medicare Advantage plans, and they have Medicare Supplement plans. So it really depends on your state and which one you're talking about. If you have a Medicare Advantage plan, you can change again from October 15th to December 7th. If you make a mistake, there is a limited opportunity to make a change January, February, March. If you're in a Medicare Supplement plan, you can change that plan any time of the year. depending on your state and also your health. So it really depends on, what you have and what state you live in. So the whole thing is just way too confusing. All right, let me see if I can find someone that I don't think is new to our community here. If Social Security pays you a month behind, when do they catch up? I switched from widows to regular. The reason they pay you a month behind is because inevitably we all have an end, and you have to be alive the entire month. So they never catch up. It's always the October check comes in November. The November check comes in December. You have to be breathing alive the entire month to get the next month's check. That's why they always pay a month back like that. Let me see. We have the best hospitals in the world. Yeah, I think we have one of the best healthcare systems in the world. Access to that healthcare completely, what's the technical term? Sucks. But we got some of the greatest doctors, the greatest technology, the greatest hospitals, the greatest system. If you got the money, if you got tons of money, I mean, people from all over the world come here when they, get really bad illnesses. They come to the United States. That's one of their destinations, is they come to the United States and get the best medical care. If you got the money, it's awesome. So, Ed, are you and your son coming to Michigan? Yeah, I don't know. I'm actually going to be speaking of, I'm going to be, my wife said I have to unplug for a few days, so I'll be back Tuesday. So I'm going to take a kind of a long weekend, and hopefully the government will be open again, but I'm not holding my breath. But unfortunately, I'm not going to the beautiful state of Michigan, unfortunately. But I will be back Tuesday. Remember, if during that time, if you need help with anything Medicare related, Medicare Advantage plans or anything like that, make sure you reach out to Chapter, make a screenshot of that or take a picture of that on your TV so you got that number there. If you have any Social Security questions, make sure, let me find my website here. On the bottom of my website, let me see if I can do this right this one time. Okay, on the bottom left of my website there, you see the little questions and comment thing. If you click on that, it takes you to the video questions, and you can ask a video question. And probably if I come back Tuesday and there's a whole bunch of video questions, I'll do a live Q&A and answer people's questions, and then I'll do another one and answer all of those questions. Speaking of, I have 1.5 video questions. There was a young man that asked me a question yesterday. I answered it, but I missed the second part. So let me answer the second part right now. Let's see here.
Oh, one other issue. Because of my retirement, we make, let's just say, $100,000 a year. The first year that she applies, if it's age 70, will she have to take the cut because we're earning too much money? Thank you very much.
Okay, so yeah, if she's age 70, then she's after her full retirement age. So yeah, it doesn't affect. Once you hit your full retirement age, you can make $1 billion a month. It doesn't affect your Social Security negatively at all. And then he mentioned he making that kind of money retirement. So if that money comes from a retirement or investments or a 401k or inheritance or whatever the case may be, that doesn't count as earned income. Only earned income, W-2 wages, and net income from business would offset anything, but that's only during your early retirement age, if you file early. So it doesn't sound like, none of that matters. All right, we've got one more question here, and then we'll call it a night.
I don't think it's going to go anywhere, unfortunately, because
my name is Bartel Boone. I completed an application for retirement 2 years early. I retired at 65. My retirement age is 67. I was wondering, do I get my spouse's retirement as well? We are divorced now, but I'm not sure how that affects me. Do I get my retirement and part of hers? Or?
Okay, absolutely. So, common question. So, you filed for benefits on your own record. Perfect. That's the first step you have to do. And when you filed for benefits on your own record, if you did it, live with an actual person, they're supposed to ask you all those questions online. They ask you those questions. Were you ever married to anybody for 10 years or longer? Were you any married to anybody when they passed away? So, if you were married to that person for 10 years or longer, Social Security should already have reached out to you and say, okay, what's that person's information? If you put it in the system, then they would have looked at that information and see if you're eligible for any benefits on that record. So if you did it online, then someone on the other end already did that, hopefully. But it doesn't hurt to double check. So because of the 5,000-day shutdown. So if your benefit, your full benefit amount, your full retirement age is less than half of that person's, then you could be eligible for benefits on that person's record. You had to be married 10 years and they have to be at least 62 years old. They don't have to be receiving Social Security benefits. They just need to be 62 years old, at least 62. So, all right. I think, we've got some new people. Let's just answer. We'll go a little long today since I'm taking off here. I'll recuperate. I just started watching you on YouTube. I wish that you were not so political. You seem to be helping so many people. I like that. Yeah, political. I'm political, but not partisan. Politics is about resources. Our resources, our human resources, our natural resources, our financial resources. Political is where you want those to go. Everybody knows that I want to make sure Social Security, your check doesn't get cut in the future. So in terms of partisanship, whether it's Democrat or Republican or conservative or liberal, whichever politician says, I'm going to make sure that doesn't happen, I'm with them. So I'm kind of a one-trick pony in that respect. I want people to get Medicare. I want people to have health insurance. I want people to get what they're eligible for, what they paid into. So whatever political party protects that, then that's who I am. So there's that. Angel, I paid $167 for my Medicare. How much is it going to be next year? I have Medicare Avenue Plain. $167. So if you paid for a Medicare plan $167, then that sounds like it's a Medicare supplement plan. So it really depends. Each state is a little bit different. Ari from Chapter talked about this a few days ago about how the Medicare supplement plans talked to the states and said, hey, we're going to raise the rates by this much. And then the state insurance commissioner approves it or denies it or whatever the case may be. So if you have a Medicare supplement plan, then yeah, you should get the word in January, February, March, depending on your particular state. So Okies all, take care of yourself and each other. Thank you, Doctor. Yeah, love your channel, gang community. Yeah, gang community. Yes, we are the true Americans. True Americans look out for each other, regardless of whether we necessarily like that person or not, or whether we're politically aligned or, yeah. So true human beings, compassionate human beings, we look out for everybody. So that's what we do here is we look out for everybody. Yeah, so that's what we do. My aunt receives Social Security disability and received a letter that her Part A and B will begin in November and the amount of the premium. I know she hasn't chosen a provider for Part B. Does she do that on Social Security website? Okay, so she's had Social Security disability for 2 years, and her Part A and Part B, her Medicare will start automatically the 25th month. So perfect. Everything is going well there. Or Part A, Part B, she'll receive the card in the mail soonish, if not already. It's probably in the mail already. So now she just has to choose not her Part B. She needs to choose what's going to cover all the gaps of original Medicare Part A and Part B. Is she going to get a Medicare Advantage plan or a Medicare Supplement plan? If she has SSDI, Social Security Disability, probably she can't get a Medicare Supplement plan. It depends on her state, but in most states, you can't get a Medicare Supplement plan. The only thing you can do is get a Medicare Advantage plan. So just make sure she does the whole, the 6 Ps, and get, figures out what providers and prescriptions and pharmacy and stuff like that, call Chapter, whoever, and gets a Medicare Advantage plan that's best for her. If she's in one of the very, very few states where she can get a Medicare supplement plan, under the age of 65. Most states you can't. In some of those states, they charge you a crazy amount for that Medicare supplement, more than anybody else. In other states, they have the weird versions of Medicare supplements, which probably won't want anyway, but it really depends on your particular state. So yeah, reach out to a chapter there and say, hey, my aunt is going to be receiving Part A and Part B here pretty soon. What does she need to do? What is available in this particular state? And they'll help you out 100% for free. And if they don't treat you right, which they always do, make sure you come back here and let us know. I stepped away earlier. Did answer my question about, is surgery expected before disability is considered for approval? Oh, I didn't see that question. Surgery expected before disability is considered for approval. If your disability case is at DDS, the Disability Determination Services, and you're about to have any type of procedure or surgery or visit a doctor, whatever the case may be, just take that information and give it to the DDS. So what happens is when you file disability, you do it at your local Social Security office. They put everything together and then send it up to a state agency, which makes the medical determination, gets all your medical records. So reach out to DDS in your state and say, hey, I've got a pending disability claim and I've got some new evidence I want to send. And they will send you a letter with a barcode on it, a cover sheet barcode. And then you take that medical stuff and fax it in with that barcode on the top, and it immediately goes to your file. If it's something more, then they'll give you the address of where to send it to. But yeah, just keep them up to date. Absolutely. Absolutely. All righty. That is it for today. I appreciate you all as always. I'll be back Tuesday-ish, and we'll get into another topic, and hopefully the government will be back open at that time, and we'll get back to the old boring stuff about making sure everybody's out there taken care of. All right, y'all take care. Have a beautiful, beautiful night, and please, please, please,